Hello and welcome to the University of Texas Medical Branch located on beautiful Galveston Island. Galveston lies on the Texas Gulf Coast and is just 40 minutes south of Houston. Galveston offers 32 miles of relaxing beaches, superb restaurants, top resort hotels, marvelous downtown shopping, incredible art galleries, and fabulous entertainment and activities. Our island has a population of about 60,000 people and is a resort getaway for people from all over Texas during weekends and holidays.
Galveston Island has been occupied since the 1500s. It has been a home to Indians, pirates, businessmen, and entrepreneurs. Galveston is named after Bernardo de Galvez, a Spanish colonial governor and general. Galveston was officially incorporated as a city in 1839. Galveston was the main port for Texas a century ago, and those days have left us with a rich architecture, history, and tradition.
UTMB was founded in 1891 and is a tertiary care medical center boasting the oldest medical school in Texas. There were 23 students in the first class. UTMB is now a very large institution housing a medical school, a nursing school, a graduate school, a physician assistant school, and an institute for the medical humanities. UTMB brings more than 18,000 jobs to the island and more than $90 million in grants and contracts. UTMB has been nationally honored as the site for a new large-scale biosafety research facility that is the key component to the nation's biodefense system. We would like to give you a feeling for the things that make our residency program special. Our internal medicine department has over 150 full-time faculty who are dedicated to teaching, patient care, and research. Furthermore, our clinical, educational, and research activity are current with the latest trends in medicine and technology. Like all residency programs, we have formal educational conferences. Morning Report starts our day and is a dynamic resident-run discussion. Our chief residents begin Morning Report with a board-style question of the day designed to prepare our house staff for internal medicine boards. We then work through patient cases from recent hospital admissions under the guidance of the medicine faculty. It is a conference we take pride in and gives us the chance to develop diagnostic acumen and a friendly environment. We learn from each other and want residents who are eager to learn and contribute to the education of their colleagues. Next, at noon conferences, general internists and subspecialists provide our residents with detailed knowledge of each of the medicine subspecialties each weekday. Grand rounds are held weekly and feature our leading faculty as well as world-renowned guest speakers.
Our residency program director, Dr. Goodgame, has recently joined UTMB from Baylor College of Medicine. Dr. Goodgame is a former program director for the GI Fellowship at Baylor College of Medicine and is a specialist in advanced endoscopy. It's good to know that our program is headed by an enthusiastic leader who really strives to make education the #1 priority. Our associate program directors are also easily accessible and involved in our training experience. Our chairman, Dr. Urban, also participates in morning conference. He has won numerous awards of excellence in both teaching and research in endocrinology.
In addition to our wonderful conferences, the crux of our education takes place caring for patients on the wards. Most ward teams consist of a resident, 2 interns, a faculty member, and several medical students. The upper-level resident runs the team. Every ward has a different flavor. Cardiology runs at top speed, efficient and cutting edge, whereas the geriatrics unit has a slower pace with the multidisciplinary team second to none. Our oncology floor is staffed with nurses and faculty who cater to the specifics of patients receiving chemotherapy. The Texas Department of Criminal Justice Hospital gives us the opportunity to see pathology that is unusual and intricate. Rotations in the intensive care unit, subspecialty months, consult months, electives, and emergency department complement the ward months. The ER is staffed predominantly by medicine residents, and we enjoy this. Weekly continuity clinics provide the bulk of our outpatient experience. Residents seeking further outpatient experience can do an elective in the medicine clinic working with our faculty one-on-one. Our rotational clinic allows time for us to choose which subspecialty clinics to attend and provides a break in the routine. We enjoy this freedom.
Our residency program is very family friendly. One of our strong points is the camaraderie that exists among our house staff. Our chairman, Dr. Randall Urban, is supportive of our desire to foster this camaraderie and supports us in organizing exciting events in which we can bond outside of the hospital. UTMB offers an excellent workout facility, the Alumni Fieldhouse. One can enjoy a modern indoor facility that includes stair steppers, treadmills, stationary bicycles, an indoor track, an aerobics area, basketball and racquetball courts, and weight room, as well as an outdoor Olympic-sized pool, an all-weather jogging track, baseball fields, and tennis courts.
Some of you will be starting families during your residency, so it's wonderful to have numerous activities to choose from in Galveston. Other than the tranquil beaches, parks, and the Gulf, the city houses many tourist attractions, which include Moody Gardens, Schlitterbahn Water Park, and a downtown neighborhood of historic buildings known as the Strand. The Strand plays host to yearly Galveston Island Jazz and Blues Festival, the Texas Beach Fest, Lone Star Bike Rally, a Victorian-themed Christmas festival called Dickens on the Strand, and Mardi Gras, which has been an island tradition since 1867. With all these activities on the island, there is no need to ever leave, but it is nice to have the fourth largest city in the United States, Houston, with an international airport nearby. Other exciting attractions like the NASA Space Center and the Kemah Boardwalk are only 20 minutes away from UTMB.
The cost of living in Galveston, Houston area is markedly lower compared to other parts of the country. Approximately half of the residents live on the island in different accommodations ranging from historic homes and contemporary homes to condominiums, townhouses, and apartments. The other half of the residents reside on the mainland in different suburbs like Bayou Vista, Texas City, Dickinson, League City, Webster, and Clear Lake, in newer homes and apartments, and only have a small 30-minute commute.
Here at UTMB, we hope you feel confident you can help design your residency to give you the experience you want to prepare you for whatever career you plan to pursue. Our wonderful house staff program coordinators also help make this happen. Many of our graduates leave the program with friendships that endure long after their residency. At the University of Texas Medical Branch at Galveston, you can live near the beach, lead a balanced life, and train to become an excellent physician. Good luck, and if you feel UTMB is a match for you, then we hope you're a match for UTMB.